first thing is this. You want to press it all the way down. Okay. The reason why the reason why is this, you want to see the back and the front. In the back view, this is a flat one, right? In the back view, you can see the T. You can't really see much of the T here unless you push it all the way down. See, what I mean T is this. Okay, so this is the letter T right here. You see this?
Oh, okay.
You see the letter T in the back? When you see the letter T, you know it's the back view. Yes.
T-bone steak.
Yeah. Okay, I would think with this. Now, okay, so I know for a fact is this. This is the back, this is the front, right? Okay, so actually, Marguerite, can you bring me a heart? The model heart? Yeah. Yes, yeah. Okay, so on the heart, you have a few things from the outside, right? You have the auricles, 1, 2, right? So these are the auricles right here. These are the flaps that you have, 1 and 2. See this? These are the auricles right here. 1, 2. Okay. Now, this is the apex right here, and this would be the base at the top, yes or no? Okay. So, what you have now is this. In front of you, you have blood vessels. Now, the one that comes out, like the most anterior, is going to be known as the pulmonary trunk. This is the pulmonary trunk right here. So, do me a favor, Jessica, can you rotate it now? Just rotate this. Yeah. This is the pulmonary trunk right here. It's in front of the aorta, right? So far, so good, right? So, I know that this is a blood vessel right here. This is one, and there's one in the back. Okay, so let's use my probe and put into the first one. This is going to be my pulmonary trunk right here. Okay, now what I want to do is this, because it's too long, I want to shorten this. So I'm going to use my scissors and cut it and make it shorter. Okay, and so this is my pulmonary trunk right here. I'm going to insert this. Now the pulmonary trunk connects with my what? Which ventricle connects with the pulmonary trunk? The right or the left ventricles? Right. So the right side, right? So it should come out onto the right side, yes or no? Now look what happens is I insert this into the pulmonary trunk. I thread it all the way to the back. It should go into what's known as the right ventricle. Is ready? See, it comes out on the right side, right? Okay, I'll cut into it in a moment. Now, in the back of that, I have what's called the aorta, right? So this is an opening in the back, yes or no? Are these two blood vessels? They look like two blood vessels. Is there a connection? Yes, there is. So that's one blood vessel, right? Now, so a lot of students ask me this, why is this one instead of two? You know the aorta goes up and it comes back down, right? So this is going to be known as my aorta. So I will cut into this and make it, kind of as one. I will unite this so I won't confuse myself. So now, this is going to be my aorta. Okay. The aorta connects to which ventricle, the right or the left? The left, right? There we go. It goes towards the left. See that? Okay. So, if I ask you this question, it says, which side is thicker, the right or the left? Okay, so if I cut into the right side, it should be easier, right? Yes. Okay, so let's begin. See how easy that was? Look at the wall. It's very, very thin. But then again, you would ask the question, is thin compared to what? Right? Right, so the left side, right? So I'm going to cut into the left side to show you. Now, look at the left side. It's going to be very, very thick, which means I have to use a lot more sarcomere to exert more force. See this? Oh, man, it's going to be really, really tough. So all my sarcomeres are in action. Okay. Now, if you compare between the left side to the right side, the left is very thick and the right is very thin. Do you see, Christina? The left, very thick, the wall, and the wall for the right side is very thin. Okay? So far, so good, right? Okay, now we're done with those two openings, right? One for the pulmonary trunk, one for the aorta. Now let's go to the back as well as this. Now, there are two more openings in the back. Okay, so we're done with the first two openings, right? Now, there are openings in the back as well as this. The first opening is going to be the opening into the pulmonary vein, right? That's one opening. And then from the pulmonary veins, I would go into what is known as my what? What does the pulmonary veins connect with what? Which chambers connects with the pulmonary veins? Don't answer at once. The left atrium. Good. So this is an opening. I'm not sure what is it going to, right? So the next opening is going to be, we're going to find the next opening. Okay. So all this is about openings. Okay. There are two openings. I'm curious. Is it the same thing? Yes, it is. So this is going to be the two openings right here. The same thing, right? Okay. So let me cut it open so I won't confuse myself. So you don't want to be confused with so many openings, right? So because it's one opening that has two parts here, I'll tell you why. Okay, now, so the only two openings that we have is this. One is the opening into the pulmonary veins, and one the opening into the vena cava. Okay, so I'm going to ask you this question: is this the opening into the pulmonary veins will allow me to go into what is known as the left side of the heart? Yes or no? Which means this must be the opening into the pulmonary veins, correct? Now, this is going to be, must be the opening into the vena cava, which allows me to go into the right side of the heart. There we go. See that? So let's cut into this now, okay? So far, so good, right? So I'm going to cut into this to access my left atrium. And I'll cut this to access what's known as the right atrium. Okay, let's begin with the front first, okay? All right, let's open this. You have your gloves on, I know you don't. Who's, Chloe, can you help me with this? Okay. Hold it. Can you just hold it like that? Okay. Can all of you guys see this? I can't do much more. Okay. First, these are going to be called the chordae tendineae. I can't do much more, guys. Squeeze in if you can. The more the merrier. The chordae tendineae, correct? Now, the chordae tendineae is going to anchor the valve to the papillary muscles. This is going to be a papillary muscles right here. So I'm going to remove the chordae tendineae. Can I take this out? Yes. Now, you can see this is going to be known as the papillary muscles, right? Yes or no? And this is going to be known as the valve. Now, I'm going to ask you this question. Which valve is this? A, is it the mitral valve? Or B, is it the tricuspid? Now, before you answer the question, is this the left or the right side? It's the left side, which means it must be mitral valve, right? Okay. Now, so we're done with that. Now, look at these little holes that you have. It's called what? Trabeculae carneae, right? Okay, so this would be right here. Do you see these little?
Yeah.
So they're called pock marks. You know, it's like these little holes. See that? All of that will represent what's called trabeculae carneae. Okay, so far so good, right? Now, this is my aorta, right? The one that comes out, which means on the aorta or within the aorta, I have what's called an aortic valve. Now, see this? I can't do much more. Come on in, zoom in. This is called an aortic valve. I can't do much more. Do you see it, Liz? Liz, do you see it?
Yes.
Okay. This little flap, do you see it, Chloe? Stand up and see it. Yvonne, do you see it? This little flap, Avery Alice, do you see it? Okay. This little flap is called the aortic valve. Okay. So far, so good, right? Do you see it? Okay. Now, on the opposite side, it's the same thing, right? Now, let's go with this right here. Okay, ready? I have what is going to be known as, this is going to be a little, Chloe, can you help me with this? Okay, hold it, see? Just hold this part for me, okay? Now, look at the strings. These are called a chordae tendineae, same thing, on the right side. Which means this valve must be called a tricuspid valve, yes or no? See this? Because the valve connects with the chordae tendineae, right? So once you have the chordae tendineae, you know this must be the tricuspid on the right side.
Oh, so it's very thin.
It's very thin. So remember, is this valves are made from cusp. The cusp is very thin. Okay. Now at the end of this, you have what is known as the papillary muscles. Okay. So also says, what are these little holes that you have here? Carneae. Okay. Good. Okay. Now, if this is my right side, it will connect with my call it T. It will connect with my pulmonary trunk, which means this word right here will be my pulmonary valve right here. So you have to come in. I can't do much on this. I'm going to show this to you. I'll pull this, and then I can't do much. Come on in and kind of look at this. This is going to be known as the pulmonary trunk. And how do I know? Here's the thing is, I'm sorry, this is the pulmonary valve. How do I know it's the pulmonary valve? Because it connects with it's inside the pulmonary trunk, right? So this is the pulmonary valve, okay? Do you see it, Liz? Liz, do you see it? Okay, all right. Now, are we ready to move on? Okay. Now, we're gonna go to the back. Okay, let's go to the back. Okay. In the back, I have this is gonna be my left atrium. Now in the left atrium, you can actually see the valve that separate between the atrium and the ventricle. Now Joan, what is that valve that separates the left from the right, the left atrium from the left ventricle called? So there's a name that's called atrioventricular valves, right? It's separate between the atrium and the ventricle, yes or no? On the left side, it must be known as mitral or bicuspid. Good. So you can actually see this is the left side, right? And on the right side, it's known as what? What is it called on the right side? Tricuspid. See this? So you have, this is the valve as well. And this is going to be the chordae tendineae. And this is going to be my right atrium. Okay. Does that make sense? Okay. So this is the back view because of the T, and the front view, right? Without a T. T in the back. Front view, there's no T. Okay. All right, go at it, guys. Okay, so you